I would now request Dr. S Ravindranath to deliver the keynote address.
Minister for Food and Civil Supplies, he was immediate past Minister for Health and Family Welfare, Mr. Kadarji, and all the executive directors and other dignitaries on the dais, and the delegates and guest faculty. Has already been discussed how to have a health for all, irrespective of their social status or economic status. The major problem in India is the population. Population, poverty, illiteracy. We have 60 to 70% of the population living in rural India, and more than 70% are below poverty line. So how to address? It becomes a really challenge, a daunting task. Health budget is meager. With the available resources, how cost effectively we can reach these people? The basic problem, as you know, if we can educate people with respect to sanitation, safe water drinking, simple thing like having food after washing hands, which is now being shown, these simple measures and awareness of health is very important. You know, nutrition is also a big issue. Because of that, we have seen a lot of lack of health care, and the nutrition will add to the maternal mortality, infant mortality is very high. When the maternal malnutrition will definitely translate into a low birth weight, responsible for increase in the infant mortality. Not only that, this low birth weight child, future will develop increased number of cardiovascular diseases and increase incidence of diabetes mellitus. We know we are having a lot of infectious diseases still with us, like malaria and tuberculosis, and which are now having a resistance. Drug resistance, malaria and tuberculosis is an issue. And also added to that, we are epidemics of various viral fevers like chikungunya, dengue fever, HIV, so many things. And on the top of that, still now we are having a non-communicable diseases is overtaking all these things. Hypertension, diabetes. Look at the gravity of the problem of hypertension, diabetes. It is in middle urban population in the middle age is 20 to 25%. I am sure 1 in 4, 1 in 5 among the audience will have either diabetes or hypertension. In addition to that, increasing incidence of cardiovascular disease at a younger age, stroke, cancer, obesity. Of course, the obesity is not that much in here, but still as we have seen, inequities. So in urban populations, socially well-off, socio-economically well-off, the childhood obesity is also can lead to various problems. So we are confronted with so many problems, and it is as rightly told, we have more focus on biomedical research. We need to have health policy research. Unless we have the health research, we cannot translate this research into policy decisions and put into practitioners and implementation. So various issues are there. I think we have with us from the university, we have running a course on Institute of Public Health and also control this Center for Disease Control. So I think we have now taken a lot of interest in biomedical research. I think I have kept a lot of 150 corpus fund for the research. I think we should fix some amount for the health policy research. I think Dr. Sudarshan is there, which is heading the department. I wish we will take the health policy research and give it to the policy makers and implementation practically how it should be implemented. I wish this your deliberations in the coming another 2-3 days. I think wish all the success and make some recommendations to the government, and we can implement whatever that is possible with our setup. I wish the program success. I thank the organizers for inviting, and Vijay Shri Holalkere, who is a Senate member of our university, also is being instrumental in inviting me. Thank you one and all.